And welcome back. Did you get the latest COVID booster? How about this year's flu vaccine? Turns out a lot of people didn't get either of these vaccines, and that has some public health officials concerned with gatherings and travel expected to surge. Many Americans are headed into the winter months unprotected.
Yeah, so here to talk about this is Dr. Megan Loon from Houston Methodist Willowbrook Hospital. Thanks so much for coming in this morning.
Thank you. Thanks for having me.
Yeah.
So Dr. Loon, kind of talk about what do you think is causing the lower than expected vaccine rates, especially with the holidays that they're now here?
Absolutely. I think that there's a couple of reasons. There's been some vaccine hesitancy that has been there for several years, and I do feel like every year it gets a little bit worse and a little bit worse. I think there's personal reasons. People are busy, holidays are here, they don't have time to go to their doctor or stop by the pharmacy. So I think there's a lot of different reasons, but unfortunately that means that each reason is one person that's not vaccinated.
Yeah, I mean, I know last year I have 3 kids, and we usually always go like around, pre-October, September, early October. We didn't get it done, and then we're like, oh, now it's so late, forget about it. Everybody got the flu in January.
Yes.
So this year I was like, let's do it. So, I mean, it's not too late now.
No,
to go in.
absolutely not. It's actually a perfect time to come in, especially with the holidays coming up. Lots of people are planning to travel and be around other family members that they haven't seen. So getting vaccinated right now is actually a really good chance to protect you and your family.
So the fact that we've seen fewer people getting their vaccinations to this point, do we think that we might see more outbreaks, more hospitalizations? And it's usually with older adults, no?
Absolutely. So that's always kind of the concern when we see these vaccination rates that aren't what we would want, is that there is a potential that there is going to be a higher number of positive cases throughout the Houston area and around the country. But when we do have those positive cases, we know those high-risk communities, those people that have health conditions, older individuals, and even the youngest kids, those are the people that tend to have higher hospitalization rates from complications from these diseases that we have vaccines for.
Mm-hmm. And kind of talk about, do you think that there's miscommunication or confusion as to why people are kind of a little hesitant about not getting the vaccine?
Yes, and unfortunately on social media and through just how connected we are online, unfortunately it's easy for misinformation, disinformation, and just overall fear of vaccines to spread to people, and it is part of the reason that we see lower vaccine rates, especially after the pandemic.
Yeah, I mean, so let me ask you this, a couple things. Somebody told me when I said, oh, we hadn't been vaccinated yet, they said, oh, if you wait until the later part of October, then the new vaccines are out that will protect you more against all of the strains. Is that true? Is it better to go like later in the season? And I don't mean like now, I mean like later in October.
So when we put out the new, I say we, but in general, when the new vaccine comes out for like flu, for example, is that we really start the newer vaccines in the September timeframe. And it is really, that is going to be the same vaccine throughout the entire flu season.
Okay.
So going in September, October, November, it doesn't change which vaccine you're getting in terms of what strands of, say, flu is covered in that year's vaccine. They've already kind of done their research, tried to determine which one of those strains is going to be potentially the most problematic, and that's the one that they put in the vaccine to produce to give to patients.
Got it. And is there something, you take that one.
Okay, I was going to say, so if you don't want to get the vaccine, what are some other ways people can protect themselves from getting sick?
Absolutely. I think the first one is, if anybody is sick, please stay home. So don't travel, don't go to work. Protect those around you by being home if you're sick. Other than that, things like good hand hygiene, washing surfaces so that you are killing any of the bugs that are potentially on surfaces that you're going to touch and then potentially be infected with. Those are all really good ways to protect yourself and your family, even if you are vaccinated, but especially if you're not.
Yeah, when you talk to patients, you said that you know that there's hesitancy among some and among your patients about the COVID-19 vaccine. So how do you approach that conversation? I mean, what do you tell them? And do you focus on any particular facts or strategies that might convince them or help ease their concerns about getting it?
Absolutely. I think it depends on what their fear is. So maybe it's a fear of the needle, or maybe it's fear of feeling like they get sick after the vaccine. Maybe it is fear of the safety of that vaccine. And really, I kind of see where they are, what information they've heard, what their fears are, and then try to address whichever one that is. And I try to just really use facts. I don't use opinions. I really want to give them the facts so they feel like they can trust what I'm saying, take it under advice, and hopefully then choose to get vaccinated.
And you know, some people, they start looking at the side effects. They're like, this is going to cause this. What if I get this? What if I get this? So how do you make it a little easier for them and explain that, you know, it's going to help you from getting sick?
Absolutely. Probably the most common thing I hear from patients is, well, when I get this, I get that, I feel ill. Like if I get the flu shot, I feel like I get the flu. And I try to explain to them that the flu vaccine that we give is not a live vaccine. So it's tends to not be that people feel ill, but if they do, it's usually a response of their immune system. So their immune system is doing what we want it to do. It's recognizing that viral particle, and it's then activating that immune system, which sometimes in the first 24 hours after you get a vaccine can make you feel run down, fatigued, sometimes feel a little ill, but overall, it's really your immune system recognizing that. So if you were ever in the future exposed to that viral particle, it would be able to protect you and defend your body from true illness from that viral.
All I have to remember when I think about that is holding my 7-year-old down on the ground saying, you will take this Tamiflu. You'll take it.
Yeah.
He's like feeling terrible and can't go back to school. And I'm like, I got this, you're taking it.
Yeah,
Yes.
you got to take it. Yeah, it doesn't taste the best.
No,
Make you feel better.
absolutely not.
Absolutely.
So we know the holidays are coming up. So what advice would you give to families to help keep respiratory illnesses from spreading, even if they're not all vaccinated?
Absolutely. I think the number one is if we can convince people to get vaccinated before they go and travel and see their families for the holidays, that's really the number one way that we can help protect. Other than that, again, stay home if you're sick, especially if you're going to be around people that have vulnerable immune systems, the elderly, the young children, those with health conditions. And then making sure, again, that we're cleaning surfaces, we're washing our hands. You know, I know that especially this time of year, all the young kids have runny noses and they're wiping their noses and then playing with toys. So making sure that you're disinfecting all of those things can really help reduce the spread of viral illnesses, bacterial illnesses, and hopefully help keep family members safe.
Right. All right.
Yeah.
All good information. Dr. Megan Loon with Houston Methodist Willowbrook. Thank you so much for coming in this morning.
Thank you. Thanks for having me.